Hello, hello. Welcome, everyone. This is the Naturopathic Medicine Institute student mentorship, and we are on our third mentorship. We have already gone whole way through from our first mentorship with Dr. Fleetwood, then Dr. Seth, and now we will have tonight Dr. Leslie Cisar speaking to us about Lindlahr 101. A couple of weeks ago, if you're a member of the NMI Institute, she did a fantastic vital conversation where she went over really essential stuff for students and for practitioners to be able to implement, so they can implement vitalistic medicine into their practices or into your student clinic shift. Because the idea of this mentorship is so that you can go on Monday and can start implementing the stuff immediately. And I just want to introduce a little bit of Dr. Leslie Cisar in here. She graduated from the Southwest College of Naturopathic Medicine in 2010. She now lives in Buffalo Grove in Illinois, outside of Chicago, where she has developed an innovative practice that uses technology to work with clients all over the United States. And at the same time, she has been able to maintain the principle of vitalistic naturopathic medicine. But without further ado, because you want to listen to her, not to me, doing this huge introduction, I will leave you with Dr. Leslie Cisar. If you have any questions, please type it on the chat box. I will make sure to be monitoring the chat box and stopping every few minutes if there's questions to give it to Dr. Cisar. But again, without further ado, Leslie, it's all yours.
Thank you so much. Thanks for having me. And as was stated before, I did a talk on this in March, I believe it was, on the vital conversation. And for those of you, I don't know if everyone listening is a Naturopathic Medicine Institute associate yet. And so if you are, as a student member, you have access to the weekly vital conversation calls. And if you're not yet an associate of Naturopathic Medicine Institute, I would highly, highly encourage you to join. The student membership fee is extremely affordable for students, and as a doctor, this has been invaluable to me as I've continued to understand exactly what we're doing here as naturopathic doctors. And so NMI has really had a significant impact on me and my practice, my patient outcomes. And so if you're not yet an associate, I would highly, highly encourage you to make the very small investment. The return on that investment is going to be tremendous. And so if you're already an associate, you might have caught my talk on this in March. And if you're new to Naturopathic Medicine Institute, then I'm so glad you're joining us today. And it's just my pleasure to bring this information to you guys. And so again, the purpose of this is really that you can have some takeaways immediately. You know, it's Friday night, it's the weekend. I'm sure you're going to be doing a lot of studying this weekend. And so this is something that you can definitely take away and start applying immediately as you start studying your cases in the clinic, etc. So let's go ahead and get started. And so, what is naturopathic medicine? This is a question that we as a profession keep asking ourselves. What is naturopathic medicine? Is it treating the root cause, right? So this is a big buzzword right now. Everybody says that they treat the root cause, right? When I go on a functional medicine practitioner's website, what they say on their website is that they treat the root cause. And then when you go on our websites, we say we treat the root cause. And even when you go on conventional medical websites, they say they're treating the root cause, right? So is naturopathic medicine treating the root cause? Is naturopathic medicine a hodgepodge of therapies and modalities? So this was something that was actually kind of confusing to me during my education as I started to learn more and more of the modalities that we use, I became a little bit confused, like, what really are we doing here? Is this just kind of like a hodgepodge of stuff? Did we just sort of like steal other professions' modalities? Like, did we just kind of steal acupuncture from Chinese medicine? And did we just sort of steal, chiropractic or osteopathic physical medicine techniques? Did we just sort of steal these other modalities and just put them under this big umbrella? It became a little bit confusing to me. Sometimes it can seem like we just have a hodgepodge of stuff. And this actually sort of impacts us when we go out into the world and we start to market ourselves, because what do you get when you're a naturopathic doctor? Like, when you go into a chiropractic office, they're going to crack your back. When you go into an acupuncturist that they're going to give you acupuncture. But what do you get when you go to see a naturopathic doctor? What are your patients getting when they come into your student clinics, right? It sometimes seem like it's just a hodgepodge of stuff that we throw together, right? And so this impacts our ability even to market ourselves appropriately, because how do you position that? It can even be a little confusing for the public, because what are they going to get? And then they get a little something different with every naturopathic office that they go into. Or is naturopathic medicine actually a coherent system? Is it a coherent and unified and comprehensive understanding of disease and the science of health and disease? And is it a coherent and logical and unified and comprehensive system for the restoration of health? Okay, and this is what has been so life-changing for me, being involved in Naturopathic Medicine Institute, and the tremendous amount of training and education that I've received over the past 3 years from NMI. I've really come to understand that actually what naturopathic medicine is this coherent and unified and comprehensive system, more comprehensive than any other approach out there for the restoration of health. And that's what makes what we do so powerful, when you're actually applying this coherent and unified and comprehensive system. So what I'm going to go over today is that comprehensive and coherent, repeatable process, repeatable system that's naturopathic medicine. We happen to use, or can use, a lot of different modalities to execute this repeatable process. But naturopathic medicine is actually this repeatable process. So let's continue. So I'm going to talk first a little bit about how I came to naturopathic medicine, to naturopathy. Why did I choose this over some of the other systems out there? So when I was in my mid-20s, my health started to decline, and I started getting migraine headaches about 3 to 4 times a week. They were really, really debilitating. And also, I had other health issues that I thought were just normal. Like, I thought it was normal to have digestive issues. I thought it was normal to be at work at 2 p.m. and feel like falling asleep in my cubicle. I thought that was just how everybody felt. But what was really bothering me was what was new were these migraine headaches. And so through a long chain of events, I got a referral to a local chiropractor from a friend, and he helped me completely transform my health and my life, and get rid of my migraines, get rid of all these other things that I thought were normal that were actually health problems. And in the course of that, I realized that this was my calling, to help other people restore their health and transform their health and transform their life. And so I started to research, okay, I feel that this is my calling, but is it chiropractic? What should I follow? And so I started doing all this research. And so I looked into all of these different modalities, chiropractic and homeopathy and Chinese medicine and herbal medicine and so on. I looked at all these different programs. And then I found naturopathy, right? And so I thought, well, what this seems to be is something that includes everything. So instead of just cracking a back, naturopathy includes cracking a back and the acupuncture and the herbs and the dietetics, all these different things. So I chose naturopathic medicine for that reason. I had no idea that there was actually this underlying coherent, repeatable system or process that really made naturopathic medicine what it was. It just appealed to me that instead of just taking one modality, I would be learning all of these different modalities. But then again, if I'm doing it all, what am I doing and why am I doing it, right? And so by the time I graduated, I kind of felt like I just had this little hodgepodge toolkit, and I really wasn't clear on why I was doing it, how to approach the case, and how to combine these things. I wasn't really understanding how to apply those modalities into this system. And if you're feeling like that as a student, I'd love for you to make a comment in the chat. Okay, so I would love to hear any feedback that you have. If you're struggling with this, please let us know in the chat so that we can address any of those questions, or we can just see if people are relating to this. So what I've come to understand is that naturopathy is not the modalities. Naturopathy is not the acupuncture. It's not the herbs. It's not the homeopathic remedies. It's not the spinal adjustments. It's not the dietary advice. That's not what naturopathy is. What naturopathy is the understanding, this coherent understanding, this repeatable process and understanding of the conditions of health, the conditions that create health, the conditions that create disease, and how you bring people back from disease and how you help people restore their health. That's what naturopathy is. So let's go into this a little bit deeper. So again, you can use whatever modalities you want to when you're going through this repeatable process. All you have to do to help people transform their health is follow the process. So what is the process? So I'm going to go back to Dr. Harry Lindlahr. Okay, so Nature Cure. My version is called Philosophy of Natural Therapeutics. Another version is called Nature Cure. Okay, everybody have this book. Get out this book. I bought this book first week of class. Okay, and then I never really learned what was in it. So we're going to go through that now. Okay, at a high level. So get out your books. All right. So the genius of Lindlahr, and the further I read this and the further I go into what he laid out here, the more and more I appreciate what a genius he was, because this repeatable process that he laid out applies really to the natural world. The more and more I get into it, not only does it apply to health and disease, but it applies to even our human psychology, the natural world, etc. It's just really an amazing concepts that he laid out here. So what I'm going to have you do is go into these books. Chapter 3 is the Catechism of Nature Cure. Okay, and if you are an NMI associate and you've been following the Vital Conversation calls, Dr. Jim Sensenig, he will refer to this all the time. There's a reason why he's referring to this all the time, because it's the critical underlying philosophy of naturopathy. Okay, so if you go into Chapter 3, Catechism of Nature Cure, Lindlahr lays out what is disease. Okay, and so again, for most people, a disease is a collection of signs and symptoms that express themselves in certain patterns that we can detect, and you check enough boxes and then you have a diagnosis. Right? For most people, that's what disease is. For our patients coming into us, they think that that's what their disease is too. But that's actually not the case. As Lindlahr says, what is disease? So he describes it as 1, lowered vitality, abnormal composition of the blood and lymph, and then accumulation of waste matter, morbid materials, and poisons. Okay, so what Lindlahr says is that any disease, no matter what the symptoms are, no matter what we've named it, the foundation, the fundamental phenomenon going on for any disease are these three things: lowered vitality, abnormal composition of the blood and lymph, and accumulation of waste matter, morbid materials, and poisons. So what does this mean sort of in today's language? Okay, so lowered vitality, this corresponds to sort of that energetic aspect of the body. This is very hard to articulate because we really don't have a concept of this in our culture yet. Okay, I think this is really on the cutting edge. You're getting more into quantum physics and applying quantum physics to health in the body. Right now, we're more on like a Newtonian physics when we're talking about health in the body and so on. So lowered vitality corresponds to, I think, that energetic aspect of the body, a lowered energetic aspect. Abnormal composition of the blood and lymph. So Lindlahr's insight is really profound when you consider he wrote this about 100 years ago before they even knew what vitamins were, right? They had a concept of mineral salts. They had a concept of minerals when he wrote this, but they really didn't even have a concept of vitamins. Vitamin C was just being discovered when Lindlahr was writing this. So, but his key insight was that the blood has to have the proper constituents, right? The body is built from the blood. And so his critical insight was, in order for the body to be functioning properly, the critical constituents, right, what we now call vitamins and minerals and nutrients and hormones and things like that, have to be in the blood. So a disease is the expression that the body generates when we do not have the proper constituents in the blood, right? And how could we be in a state of health if we don't have what we need in our blood? And then third, accumulation of waste matter, morbid materials, and poisons. So this is what we call in today's language toxins, right? And so this is a very hot topic, right? This has reached even mainstream. It's coming from Lindlahr, okay? So as Dr. Jim Sensenig says frequently on the Vital Conversation calls, we can't be healthy if we're swimming in toxins, okay? We have to take out the trash. And this is what Lindlahr was referring to, something that is now very mainstream, detoxification, right? Removing these toxins. So when you start moving away from this concept that disease is the diagnosis, right? And there's something more fundamental going on, and these are the three fundamental things that are going on in the body. Then the body is adapting or responding to these conditions, these abnormal conditions or conditions that are not promoting health. The body responds by generating symptoms, signs and symptoms. And then what we have done is we have developed these little checklists, right, that guide our diagnosis. But what really is going on are these three conditions in the body. So how do you restore the sick to health? Well, you reverse these three conditions, and then Lindlahr gives us another three things to do as well. But first, what Lindlahr tells us to do, and again, this is in the Catechism of Nature Cure chapter 3 in the Nature Cure book. So what we need to do is we need to reverse the three conditions that are generating what we call disease in the first place. So we have to, he calls it, economize the vital force. We have to increase the vitality in the system. Okay, we have to work on that energetic level of the body that regulates and keeps things working in harmony. That's our vital force, right? We have to restore and tonify and restore the resiliency in that vital force. We have to build up the blood, and as Lindlahr says, build up the blood with its natural constituents in the right proportion. Okay, so we have to get we have to get what should be in the blood into the blood. And then we have to promote the elimination of waste materials and poisons. Okay? We have to detoxify. That's what we call it in this day and age. And then he has 3 other things that we should do to restore the sick to health. Okay? So he says we should establish normal surroundings and natural habits. Okay, and so this is looking at people's things like their lifestyle, right? When are you going to bed and when are you waking up? What are you eating? What are you thinking? Okay, so there we have a lot of habits that do not support our health. Okay, in some schools, these are called the conditions of health. Okay, so some of you might be familiar with that term. You need to look at some of these lifestyle factors. Are they health promoting or are they health draining? Okay, and a big thing is our mental emotional habits. Okay, the next thing he says is correct mechanical lesions. Okay, and so if there's a rib out of alignment, we should put that rib back into alignment. And then third, this is my favorite one, arouse the individual in the highest possible degree to the consciousness of personal responsibility and to the necessity of intelligent personal effort and self-help. And I love this one because if you don't have this, you can't make the changes necessary to support any of the other 5 areas. So let's go a little bit deeper into these 3 things. Let me pause. Do we have any questions in the chat?
No, we do not. If anyone has any questions, please type them in the chat box and I will ask them to Dr. Cisar. We do not.
Okay, all right, let's continue then. So basically, these 6 things are like a checklist of things for us to do. And what I have found after I started applying this checklist to my work with my patients, just amazing, amazing, profound results. If you do these 6 things with every person you work with, they have to, there is without a doubt that you will have a positive impact on their health. So many times when we're a student, when we're a new graduate, we feel like, well, can I really help people? I don't know. Do I know enough? We have some insecurities about our ability to help people. But I'm telling you, if you just do one thing in each of these 6 steps, you will have an amazing and a profound impact on everyone that you work with. And this is the beauty, I think, of what he laid out for us. He gave us 6 very clear steps. And then even if we don't have the full level of sophistication or knowledge or experience, every one of us can come up with something in each of these 6 steps, no matter what our experience level, no matter whether we're a student or a new grad. We can definitely find at least one thing to do in each area. And if we just do that, we're going to have a profound impact. And then we can continue to grow and can continue to become more and more sophisticated and artful in what we're doing. And the 6 steps stay the same, but we grow more and more in our ability to execute on these 6 steps. So again, I think this expresses the genius of what he's laid out for us because it works for the novice and it works for the experienced doctor as well. So let's dig into these one by one. So the first one, build up the blood with its natural constituents in the right proportion. Now, I want you to think of your physiology textbook. I want you to think of your embryology class. I want you to think of histology. I want you to think of pathology, biochemistry. What is supposed to be in the blood? We have a great deal of knowledge nowadays that Lindlahr didn't even have. Now we have testing. We know a multitude of vitamins and minerals and other nutrient cofactors now that Lindlahr couldn't have even dreamed of. We have tests to check for hormone levels in the blood. We know the biochemistry. We know how, we know what should be in the blood. We know how does it get there. We know how the constituents are made. We know how they're circulated and transported. So think back on your basic sciences. Every time we open up a basic science textbook, anytime we're studying for a test, anytime we're referencing something, we should be thinking to ourselves, does this impact the composition of the blood and the lymph? Okay, so what should be in the blood? How do we get things into the blood? Well, the first thing is we should be eating food with nutrients, right? So next, we should be able to digest the food that we're eating, extract those nutrients, and get them into the bloodstream. Okay, so once I know what should be in the blood and how does it get into the blood and what are the processes that make it, then I can start, when I'm sitting in front of someone and getting their case, then I can start putting those pieces together in my mind. She's been taking this pharmaceutical that inhibits stomach acid for 10 years. What I know about the physiology of digestion, I know that I need adequate stomach acid in order to extract the nutrients from my food and absorb, say, minerals in particular, right? And so now I know that when I have someone who's been on a certain pharmaceutical, or when I have someone that has certain symptoms, if I have a patient that's had blood and mucus in the stool for the past 5 years, I know that the digestive tract is not functioning optimally and that they're going to not be extracting their nutrients from their food. I know then that their blood is going to be deficient in certain nutrients. It's not going to have the proper constituents. Okay, so how does that impact my treatment plan? Well, I think I better improve their digestion. I think I better work on the gut, right? What are we naturopaths famous for, right? Working on the gut. Why do we do that? Because we have to do that in order for us to be able to get the proper constituents into the blood. Do you see how this all ties together? If I have a thyroid hormone deficiency, I don't have the proper hormone levels in the blood. I can run a test for that, right? So then I can decide, do I want to write a prescription for that? How do I want to handle this? Or do I want to give herbs for the thyroid, or are there nutrients to stimulate the thyroid, right? But the problem is not the disease of the thyroid. The problem is I don't have the proper hormone level in the blood. Everything ties back to, do I have the proper constituents in the blood? I can look at what would prevent, we looked at digestive issues, right? Preventing getting those nutrients into the bloodstream. Would there be maybe a genetic factor where I don't have, I don't have the ability to make transport molecules, right? Well, that would be a factor. And I mitigate that with a therapy. So again, every time you're looking at your basic science textbooks, when you're learning something, you should be relating that. How does that relate to this checkbox that Lindlahr gave us? And then you'll start to build up this knowledge. When the light bulb kind of went off for me and I realized that I have a checklist here, I actually got out a piece of paper and just started writing down, okay, what do I know? What do I know from physiology and biochemistry, et cetera, that's going to impact getting the proper constituents into the bloodstream? Then what therapies or modalities would you use to correct this, right? So could you use certain herbs? Would you supplement certain nutrients to correct deficiencies? Would you change the diet to make sure that they're actually eating nutrients in their food? What lifestyle factors would be at play here? So then you can see that the modalities, it's not just a hodgepodge of modalities, but we can do a lot of different things to address this first checkbox. And so when you're in class and you're studying the different modalities, ask yourself, how would this herb impact the composition of the blood and lymph? How would this, what acupuncture points would I use to improve the composition of the blood and lymph? What dietary recommendations would I meet, right? So again, you go through your modalities and you start to analyze them. Okay, what's useful for this first checkbox? And then you start to build that mental model. So then the second checkbox from Lindlahr, promote the elimination of waste material and poisons. Detoxification, again, we go back to biochemistry. We know how these metabolic wastes and toxins are generated. We go to environmental medicine class, we learn about environmental toxins, right? How are they absorbed? What are the issues with that? How are they eliminated? What is required to eliminate them? Are there certain nutrients that are required? What promotes the elimination of them? So, I had a class on elimination modalities such as sauna, enema, etc. And so what therapies or modalities would you use to promote this? So again, when you're in pharmacology class, okay, well, this drug really wastes these certain nutrients, or this drug is detoxified in this way. You can start to relate the science courses to, okay, how would this impact? How would this biochemistry pathway, how would this aspect of physiology, are there certain pathologies that impair detoxification, right? You start to put everything in that context. And then again, what herbs, what modalities, what therapies are you learning that address this checkbox? And then the third checkbox he gives us is to increase vitality. So what decreases our vitality? What increases our vitality? So again, things like the quality of the food that we're eating, lifestyle choices, psychology aspects, our mental, emotional, and spiritual life, our internal dialogue, our relationships. What increases vitality? Things like homeopathy, hydrotherapy, energy medicines like acupuncture, etc. You can start to go through the modalities that you're learning and say, okay, these are the things that really have an affinity for increasing the vitality. And then the last three that he gives us are correct mechanical lesions. Okay, and so again, when you're in physical medicine class, you're learning how to assess for anatomical or mechanical lesions and how to correct those. Establish normal surroundings and natural habits. So again, this goes back to lifestyle, home life, relationships, that mind-body connection, their spiritual life, all of these things. And then finally, the last piece, my favorite piece, arousing a sense of personal responsibility for their health and a sense of driving, helping people realize that they can take action and they are actually in control of their health. Definitely our way of relating to patients, our demeanor with them, how we approach patients. Each person needs a little bit something different in this area to motivate them or inspire them. I also structure my practice in a way that builds this in. And I talk about that in the business track of the NMI. So I'll talk about that a little bit more later. And so this is why protocols for diseases don't work. So when we know that we have somebody coming in with Hashimoto's and Crohn's disease, what we tend to say to ourselves is, well, what do you do for Crohn's disease? What herbs do you do for Crohn's disease? What do you do for Hashimoto's, right? We think like, how do I treat the disease? What have other people used in the past that have been successful with these things? That's sort of like asking for a protocol. What do I do for this? What's the protocol for this? protocols don't work because the disease doesn't matter. What's more fundamental to the diagnosis are those three main things. The vital force, building up the blood, and promoting the elimination of waste materials. Those are the three underlying things that are universal to any disease. And how you're going to correct these things for any given patient can vary depending on the patient. And so when we think about things as a protocol, the protocol worked for one patient, but it may not be the exact mix that is needed for this other patient. We need to be looking at this deeper level. So how do you approach the case? So again, use this as your checklist, okay? So first, looking at what do I need to get into the bloodstream? Right? What is lacking in the bloodstream? What natural constituents are not there or in the wrong proportions in the bloodstream? That's a question that you need to ask regardless of whether it's Crohn's disease or whether it's Hashimoto's or whatever it is. That's more of the fundamental question. If we have somebody coming in with Crohn's disease is not the problem. The problem is the inflammation in the digestive tract is preventing the assimilation of the nutrients from the food. That's why we do what we do for Crohn's disease, so that we can get the nutrients into the bloodstream. And we're not just doing it to get rid of the symptoms. We're doing that so that we can get the constituents into the bloodstream. And so when you approach a case, what you want to do is, when you're taking the case, you want to ask yourself, okay, what irregularities are there in the blood? What is preventing, right? You have the biochemistry, you have the physiology knowledge, you know how things that should be in the blood get in the blood. And so what are the blockers for this person, right? If they have Crohn's disease, that's the blocker for them. We have to heal the digestive tract. So when you're taking the case, start going through, okay, what's the blocker for proper composition of the blood for this individual? What's the toxin load for this person? Is there anything that I need to take into consideration when I think about detoxification and promoting detoxification for this person? How do I want to go about increasing this person's vitality? How do I want to work with them? How do I want to assess their habits? And how do I want to work with them so that they can change their habits? And then mechanical lesions, assessing for that and correcting that. And then the last one, encouraging the highest sense of personal responsibility and action on the part of the patient. So if you can identify one thing in each of these areas, you will have a positive impact on somebody's health. So for the first one, the most obvious thing that we can impact people with to get the proper constituents into the blood is assessing someone's diet. And there are so many stories, right, of people having miracle health recoveries just from changing their diet. Well, Lindlahr tells us why, right? Because when we are eating foods with nutrients, we will get those into the blood, and we will have the proper composition of the blood. Other things that you could think of like that, think about on this first one is maybe alterative herbs or something like that. There's a lot of herbs that help build up the blood, return the blood to normal. You want to look for any blockers that would block the getting nutrients in or hormones getting into the bloodstream, etc. Any blockers that would block that normal composition of the blood. What could you do to help someone eliminate toxins, right? I'm sure you can think of many things, many different herbs. Even if you just gave someone milk thistle, right? Any naturopathic student can recommend milk thistle to improve detoxification, right? Increase vitality. Have people go outside and touch the earth, right? That increases our vitality. Think of other modalities that we have that increase vitality, such as homeopathy or acupuncture or hydrotherapy, working on some mental, emotional aspects can increase vitality, right? So as you go through this checklist, just identify, what the blockers are in each of these areas for the individual, and then come up with something from our toolkit that will address that. And so this is why when you ask doctors that have been in practice for a long time that actually understand how to do this, and you ask them, well, what would you do for such and such? And they go, well, you could do anything, right? And it's so frustrating as a student or a new doc when you ask that question, and these longtime docs just kind of go, well, it could be anything, or I'd have to know more about that individual, right? That's because they're basing their decisions on what they're going to do in each of these 6 areas in a way that's unique to that individual. This is what it really means to treat the individual instead of the disease, right? When you're working on these 6 aspects, you're actually treating the individual. And it really doesn't matter. It matters to some extent, but really, if I choose to give somebody milk thistle and you choose to recommend enemas, right, both of us are still promoting detoxification. So this is why when we are asking for treatment recommendations or help with cases, right, it's like, well, could be anything, right? It doesn't matter what it is as long as it's working in each of these 6 areas. So let me pause again. Do we have any questions?
We do not have any questions at the moment. If anyone wants to ask a question, please type them, go below into the bar that says chat, and it will open a window on the side and you can type your question.
So while we're waiting for some questions, I do want to talk about this 6th checkbox. Arouse the individual in the highest degree to the consciousness of personal responsibility and the necessity of intelligent personal effort and self-help. So I mentioned before that I structure my practice very specifically to build this in. And I've done some training calls on this for Naturopathic Medicine Institute associates. So one of the benefit of your associateship with NMI is we have a business and marketing track. And what I've discovered in my own practice is that when we structure our practice and when we sort of mirror the conventional model, which is come in, I tell you to do something, you go away, and then you come back in a few weeks and we see if it worked or not. We're really mirroring sort of the conventional approach because, they're just giving a pill, right? It's either going to work or it's not. There's no action that the patient needs to take other than taking the pill. And what we've done is sort of mirrored our practices against this to this model. And it's not enough support and it's not enough accountability for our patients to really work with them in this area. So I've actually structured my practice to build this piece, this piece in to support this piece. So I think when we go through this checklist, when we really internalize what Lindlahr is telling us, it impacts not only how we approach the case, how we approach our study of the basic sciences, what we recommend, But if we're really going to follow what he's saying, it can even, in my case, it prompted me to change my entire practice structure so that I could really leverage this particular piece. So do we have any questions coming in?
We do not have any questions at the moment. Oh, we do.
Okay, great.
So someone's asking, how do patients respond to this way of treating disease? Do you discuss your philosophy with the patient so they know what to expect?
Oh, great question. So I actually do. So my goal for everyone that I work with is that they learn these basic principles and they learn how to apply them to their own life and to themselves. And so I actually go through the three main things with all of my patients. So I actually train them on these three pieces here. So when I recommend a dietary change, I explain to them the rationale of the dietary change in relation to these three principles. I absolutely do that. When I recommend things for detoxification, I say, okay, this is what we're doing specifically for this. So I call these the three pillars when I'm working with my patients. I very, very consciously educate them on what these three pillars are, how their body sort of expresses it. So when one of these things starts to go south, how their body starts to express that to them so that they can understand that feedback going forward. And then they can, again, that sixth piece that Lindlahr tells us to do, inspire them to have the highest sense of personal responsibility, then they can take action. So it's had, it's been a real profound shift in how I work with people. I absolutely train them on this and show them how this applies to them. You know, what we think of disease as these signs and symptoms that like came out of nowhere or something, right? What they are is how the individual's body is expressing these three things, right? So we obviously we inherit certain predispositions towards the expression, right? But the fundamental thing that's going on with everybody are these three things: lowered vitality, abnormal composition of the blood and lymph, and accumulation of toxins. That's going on with everybody. How an individual expresses that is unique to the individual, and that's what we call disease. We don't call disease this, right? We call the expression of this disease. We've mislabeled it, and Lindlahr properly labeled it. Great question. What other questions do we have?
Oh, we got another question now. Oh, no. First, thank you for your time this evening, Dr. Cisar. Can you speak more to your current practice structure that helps insulate your patients in after leaving your office with your care plan? Personal, email, phone, check-ins, nurse practitioner, or health coach support?
Yeah, great question. So I work with people in a 12-week period of time, sort of like a 12-week package. So what I found is that if I practice the way that I was sort of trained to practice in, sort of the traditional way of practicing, where you do an intake and then you make a recommendation, you send them home, back to their environment, back to their old habits, and you tell them to come back after a period of time. People don't have proper expectations. Some people think that their health will transform with no or minimal effort on their part and within 1 or 2 visits. Okay, and I work with people that have very chronic, long-standing conditions. They've taken a lot of suppressive medications over the years. And so what I found is that it takes 12 weeks. When I apply these 6 steps that Lindlahr laid out, I can get a very significant transformation in their health in a 12-week period of time. So I tell people up front that we're going to work together for 12 weeks. And then I actually meet with people weekly for that 12-week period of time. And so that allows me to really educate them on what we're doing. It allows me to closely monitor them. And it sets the expectation up front with them that I don't wave a magic wand here. You know, if you want to restore your health, you're going to have to take action. It's going to take time. It's a process. It requires, you know, again, the people that I work with, it requires a great deal of effort on my part and their part. And so I set those expectations up front with people. And so some people are not looking for that. Some people want more of, can't you just give me something natural to take away the pain type of thing? And so before I would get a mix of those people in my practice because I wasn't really even conscious myself of what I was doing, and I certainly wasn't setting expectations up front with people. And so I would kind of get a mix of people with varying levels of commitment. And I want to work with people that want to experience the same transformation that I experienced like 20 years ago in my own life. Like that's what my calling is. That's what called me to do this. And not everybody has that calling. Some people want to serve a different type of patient. Some people want to work in a different way. I'm not advocating that what I do is better than anybody else or anything. You have to follow your own personal calling. But this happens to be mine. And so when I wasn't telling people up front what it was going to take to get that transformation, I would get people they were only in it for a couple appointments. They weren't in it for the transformation. And and I would wonder why, and I would blame myself, and it was just a whole psychological ordeal. And so again, when you really get into this and you realize, okay, this sixth piece, the way that I do it is I tell people up front that we're going to meet weekly for 12 weeks, and you're going to experience a massive transformation in your health. Not everybody wants that, and that's okay. There's plenty of other practitioners out there that can give them more what they're looking for. But the people that I work with that have been praying for somebody to help them do that, it's been amazing. It's been absolutely amazing.
Okay. We have another question. In your experience, do you find that one of the three pillars, vitality and normal blood composition or elimination of weight, is more difficult to treat or move in the direction of healing? If so, do you have some treatment modality pearls?
Okay. Great question. So now that I am looking for these things, before I got involved with NMI and I learned this through NMI, I wasn't looking for these things. It's even hard for me to put myself back in the shoes that I was before, because I've made this complete paradigm shift. But now everything that I do, I'm looking for these 6 things, because I know Lindlahr has told me if the person's sick, these are out of whack. So there's not a doubt in my mind that I'm going to find something in all 6 of these areas. Okay, particularly the 3 main ones. Okay, and so there is a difference from person to person. Which one is more out of whack? There really is a difference, and this is part of the art of what we're doing here. And this is why protocols don't work. So for some people, they've been eating nutrients. Their digestion is working. Their hormones are good, right? The composition of the blood, we don't have to do too much on. Some people are so overloaded with toxins, right? I work with people that have been taking very suppressive medication for a long time, and so this is a big factor for the people that I work with. Many of them are extremely burdened with toxins. And so there's some nuances to that, to clearing those toxins. The more toxic people become, the more sensitive the system becomes, and it becomes even harder sometimes to clear those toxins because the toxicity is making them hypersensitive in some cases. And then some people, it's mostly in the vital force. So that vitality aspect, right? The vital force is the organizing energy of the body that keeps the body in balance, keeps the body in homeostasis, or as Dr. Louise Edwards calls it, homeodynamics. Okay? If there's no vitality in the vital force, we can't maintain a state of health. And we can drain that vitality through a lot of different ways. Poor lifestyle. What I find many people are completely draining their vitality every day because of their mental emotional state. Okay? And so for many people, the vast majority of the healing has to take place on more of the energetic level or the mental emotional level, sort of that mind, body, spirit connection. And some people, that's not a factor for them at all. And it's really just more if we get the nutrients into them and clear the toxins, they have this amazing recovery. So it is very different. You know, these three things, these three main pillars, Dr. Jim Sensenich calls them the three legs of the stool that our medicine sits on. It's the three legs of the stool that our health sits on. There's a different combination in each individual, which one is a little bit more prominent or which one needs a little bit more care. So I can't emphasize enough, this is what it means to treat the patient and not the disease. This is why protocols don't work. Great question. I hope I answered, was there any other, was there a second part to that question, or did I answer it fully to your?
I think you answered fully.
Okay, awesome.
If the person wants to write more, if she wants to ask more, then she can ask. Okay. Yeah, go on, Dr. Cisar.
Okay.
Oh, wait, we got something.
Okay.
In terms of identifying the center of gravity in a patient's case, what methods do you employ?
Okay, so great question. So when I was at SCNM, we did not use the term center of gravity. So I don't really know what you mean by that. So I'm sorry, I know some schools teach it that way, but I wasn't taught that way, so I'm not quite sure what people mean when they say that. So what I would say is if you go back to these three main legs of the stool, right? These three things, right, Lindlahr tells us are always going to be in play. And so, by center of gravity, I don't know if you mean...
no, he says he means organ of greatest deficiency.
Organ of greatest deficiency?
Yeah.
Okay, gotcha. Well, what I would do to using Lindlahr, right? So, so the way that I look at this is, I'm always looking at, okay, I've got to get the composition of the blood and lymph correct. And so, are there different organ systems that are blockers to that happening? So your digestive tract, this is the major one that's going to be a blocker, right? Because we can't get anything into the body unless it goes through the digestive tract, a properly functioning digestive tract. And so that's, I conceive of it, maybe we're thinking the same way, but just calling something different. What I'm always looking for is, what are the blockers? Okay, so if I have a set of adrenal glands that are completely burned out, then the cortisol levels are not going to be correct. The cortisol levels in the blood are not going to be sufficient or ideal, optimal at 4 a.m, right? And so I'm looking for those organ systems, right? I'm going back to my physiology, my biochemistry, my pathology. What what does this person have that would be a blocker to the proper composition of the blood and lymph? So we might be, does that sound like we're talking about the same thing?
Yes, thank you.
Okay, awesome, awesome. So yeah, I think what, as naturopaths, right, what we should be doing is we should be just going back to Lindlahr. I mean, I think Lindlahr really eloquently lays this out. And I think over time, what's happened is we've kind of developed some of these other ways of talking about it, etc. They're not consistent between schools. It's confusing. Like, I don't even know what you mean by center of gravity of the case, even though I know some people use that term, right? When really, in this book, we have 6 steps, right, that we could all be referencing, right? And then we would all know what we're doing and what we're talking about. All be trained to approach cases and trained to approach the basic sciences in the same way. And then we would have a actual cohesive foundation that all of us would have, right? It's laid out here. We just need to use it. That's my little soapbox. Any other questions?
Okay, if you have any other we got another one. When do you feel a sense to refer when you hit a roadblock within a 12-week duration? Oh,
okay, gotcha.
Oh, you got it? Okay.
So far, I wouldn't say that I've hit a roadblock. I'm in an unlicensed state, and I work with women all over the country over the phone using technology. And so anyone that I work with is required to have a home physician, etc. They have to have their medical team on board. And so if I have any concerns about their conventional medical care, I address that with my client, and if I may communicate with their doctor. So I have a little bit different dynamic as far as referrals go. What I've found when I have started applying these 6 principles is tremendous transformations and results. Things are much easier for me now than they used to be before I started applying this, because when you start leveraging these 6 things, it's like magic. When you read the old case reports of the old time docs, and you read, these miracle cures, and you're thinking, how did they do that, right? I used to think that. And I got to be honest with you, now it happens to me. I'm just doing these 6 things. And it's really some basic, simple interventions, like bitters herbs for digestion, right? I'm not going in with like high dose things or like cutting edge, formulations and all this stuff. I'm just using just some of the standard herbs and things like that we're taught, standard modalities, but I'm conscientiously applying them in this way, and the body responds. It's not the herb that's doing the healing, it's the herb removing the block, and then the body does the healing. When you start to practice in this way, you really, really start to see that in a way that I really wasn't seeing before. I hope that answers the question. Any other questions?
Yep, we have another question. Other than
Great.
NMI and Lindlahr, are there any other resources for trainings you will recommend or found helpful for those of us who want to use the Vitalist Nature Cure approach of treating patients?
So, Hahnemann, organ medicine. So I think, Hahnemann predated us. And when I read Lindlahr, I can hear how they've taken Hahnemann in the homeopathic philosophy. And so when I was at SENM, I was very specialized in homeopathy. I did 10 homeopathy shifts in the homeopathy department at SENM. So I had extensive training in homeopathy. And if you are going to practice in a vitalistic way, you have to know how to stimulate the vital force, right? And homeopathy, in my opinion, there's nothing more efficient than homeopathy to do that. So before NMI existed, before I, understood Lindlahr, I understood the organon, and I understood homeopathy. So that gave me, Hahnemann coined the term vital force, right? So what our founders drew on is a lot of the homeopathic philosophy. You can hear that in a lot of the writings. So I would recommend the organon. I would really recommend that. A lot of people are intimidated by the organon, but if you go through, the language sometimes is a little archaic, but if you go through that and you look at it, I think if you go through the organon with these 6 steps from Lindlahr and kind of marry those two, that's had a big impact on me. And then I can't recommend NMI more highly. I tell everybody that NMI literally changed my life, and it sounds kind of like maybe I'm being histrionic to say that, but I can't be more sincere when I say that. If you want to learn from the vitalistic doctors that know how to do this, know how to get those like miracle cures from the old cases, they're in Naturopathic Medicine Institute teaching us every week. So I can't recommend NMI more highly. And then if you're like me and you bought this the first week of school and then you never really cracked it open, crack this open, okay? If you just go through the chapter 3, the Catechism of Nature Cure, and just read that and start again, even if you're not in the clinic yet, start when you're studying the basic sciences, ask yourself, how does this relate to these 6 things? Does it impact one of these 6 things more than the other? Some aspects of biochemistry impact more than one of these 6 things, right? Some modalities impact more than one of these 6 things. Start to gain that understanding. Any other questions?
Nope. We're getting a bunch of thank yous, but what do you do to help someone with mental, emotional issues?
Okay, gotcha. So first of all, we have a misconception culturally that the mind is separate from the body, right? And so people go to therapy for years and continue to eat the way they eat. They don't do anything to clear toxins, right? Our mental health, right, is directly related to our physical health. We even talk about them as separate. They're not separate, right? I mean, we're one person, right? The health of my my mental, emotional aspect of my being is directly correlated to the health of my physical being. So this is, just a tragedy on so many levels that we don't connect those two. So that's number one. I mean, you start getting nutrients into the body and you start clearing toxins, you think somebody isn't going to have better mental health? I mean, I've fasted many times. By the end of the fast, I'm like, wow, my mental clarity, my mood, everything's improved, right? So what we do on the physical level is going to impact that. What I've done over the years, I've always been really interested in that mind-body-spirit connection. And so when I was a student, I did some electives in that area. I've done my own personal work in this area. So this is something that when I work with people, I incorporate a lot. People have, when you talk about established normal surroundings and natural habits, okay, so people have so many habituated thought processes, and habituated coping mechanisms that don't support their health and that drain their energy. So one thing that's really common is that people are constantly criticizing themselves. Right? We have this internal dialogue. I mean, we all do this, right? We have this internal dialogue that's just berating ourselves all day long. Well, that's a massive, massive drain on our vitality that I've observed. And so this is something that I work with people, just identifying the fact that they're doing this, getting to, why are they doing this, right? Many times it's set off in childhood and the family dynamic. And so getting to that level, getting to these levels, it's a great question. I think for me, it's a critical piece of the healing process. Another reason why I tell people we're going to do this for 12 weeks and we're going to meet weekly, because in order for me to take people to that level, I have to really work with them consistently and get to know them well and gain that trust and rapport so that we can work through some of those issues. But I think this is a major, major blocker to healing people have, is these mental emotional coping mechanisms, mental emotional habits, mental setups, false interpretations of what's happening in the world, within their relationships. All of these things are massive drains on our vitality and affects our health. And so we can't bring the vital force back into tune. Hahnemann says that we become sick when the vital force becomes untuned. Okay? And so the healing process is tuning the vital force again, bringing the vital force, I call it, back into balance when I work with people. So we can't do that if people are completely draining themselves every day with all of this, some of this mental, emotional turmoil that people are in. So to me, it's a critical piece of the healing process. And a big reason why I can do it is because I've worked on this myself. I'm kind of just a few steps ahead of the path.
Then, we've reached the end of the mentorship. I don't know, I talked to Dr. Cisar if she wanted to speak a little bit about the Vital in the Business, which is one of your privileges if you belong to the Naturopathic Medicine Institute. She has a series of recordings that are wonderful. I have listened to them all. I have learned a lot from her mentorship and from the stuff that she teaches you, not only about mindset, but about the economics of a private practice, the growth, the marketing, the branding. All this kind of stuff are in the Vital in the Business, and you can just take advantage of it if you're a member of the NMI. If you're a student, it's $50. If you're a student and a member of your NMSA, it's $25. So take advantage of it. It's one of the biggest things that we have. Dr. Cisar, do you want to go a little bit and talk for like 10 or 15 minutes about the Vital in the Business opportunity?
Yeah, thank you. Yeah, so this is my second passion after vitalism, helping vitalistic naturopathic doctors have successful practices. And by successful practices, as far as outcomes, clinical outcomes, and let me see if I can share my screen again. But as clinical outcomes and financial outcomes, okay? And so there's sort of a misconception that you can't make a good living as a naturopathic doctor. There's a misconception that in order to make a good living, you kind of have to sell out a little bit, and that if you practice vitalistically, you can't make money. And that's absolutely not true. Absolutely not true. So this is something that, when I opened up shop, I had every issue you could imagine, from my own personal mindset, my money issues, the whole thing. And so I'm coming up on 9 years since I graduated. I've spent the past, 8-9 years just working tremendously on myself, so that I could have the practice of my dreams, and that I could make a very, very nice living that I'm very happy with. And so one of my passions with NMI is to help other vitalists achieve that level of success, because it's absolutely possible. So when you're one of your benefits of joining NMI is twice a month, I do a call. We call it the Business Builder Call. And we have a private Facebook group for people that are interested in this track. And so last year in 2018, I did a whole curriculum on how to develop your ideal practice. So before, I was practicing sort of like I thought I had to do it the way everybody else did it, and so that's what I was doing. And then because I wasn't in alignment with what I really wanted to do, it didn't work. I didn't achieve the results that I wanted to achieve. And so once I brought myself into alignment, once I actually implemented what I was in alignment to, that's when I started achieving the success that I wanted. And so I created a curriculum to help people identify what they're actually in alignment with, and then how to implement that. So that's recorded and available. And then going forward in 2019, we've continued the twice a month calls, and we've had various topics. Lately, we've been doing a lot on money mindset issues, okay, which I definitely struggled with tremendously, and it's something that's holding a lot of us back from having a successful practice. So just, I think it's a really phenomenal member benefit for NMI as well. And Dr. Santiago, I'm glad you agree. I'm glad you've enjoyed it so much. You're regular on the calls, and I appreciate that.
They're great. So I do try to attend them.
Any other questions?
Any other questions? We are mostly done. Again, remember everyone that you can gain access to the recording of this presentation and the past mentorships if you are an NMI student. You just or an NMI member, associate, or the many alternatives we have. You just need to go into your NMI account, go to events, and there is a tab that says student membership, student mentorship. Anyway, we are always looking to teach as many people as we can about vitalistic medicine, about all the aspects of practice, about how to apply these principles in your practice, because they're infallible. I'm a new practitioner, and I have found tremendous benefit from the NMI in my past 2 years before I graduated. It has changed my mind on how I see patients. I'm one of those that went to many seminars at school, and I had functional medicine, I had applied kinesiology, I had homeopathy, I had biotherapeutic drainage, I had all the things, primary care, all the things that we learn at school. But I felt that when I started listening to NMI, stuff started to make sense. Okay, I don't have to be worried about learning the 10,000 diseases that have ICD-10 codes. I don't need to learn the 10,000 protocols that we need to learn if you look at nutritional medicine by Gaby, or you look at all these protocols that come out from so many places. I felt what Dr. Cisar said is what I found out when I joined the NMI, is you need to treat the vitality. You need to increase the blood and lymph. You need to provide the body what it needs, and you need to remove the obstacles of health. Those three things are the pillars of naturopathic medicine, and those are the things that we need to do with every patient. I think that will be enough. Any final words, Dr. Cisar?
No, thanks so much. Really appreciate you having me on. And I would love to hear from anybody. Again, when you're studying this weekend, studying your cases for the clinic next week, get out your checklist and put something in each box, okay? And you're going to have a profound impact on someone's health when you go into the clinic and present your case to your supervising physician, right? Well, here's 36-year-old female, diagnosis XYZ. In order to improve the composition of the blood and lymph, we need to improve our digestion. We need, right? Even when you start to present your cases to your supervising physicians, present your rationale for what you're doing with these 6 principles from Lindlahr. Okay? We're naturopaths. He told us what to do as a naturopath, and so we should be doing that. And then again, if you're not in the clinic yet and you're just doing the basic sciences, start to build that mental model. Okay, for this pathway, this impacts detoxification, right? Start building that mental model of how all of the sciences apply to these 6 principles. And you'll be way ahead of me when you graduate, because it took me several years to to realize this. So like Dr. Santiago, he was involved with NMI while he was a student, and now he's hitting the ground running as a doctor. So good for you. Good for you. So I wish all of you all the success in the world, and please feel free to reach out to me and let me know how you're doing.
Okay, everyone, this was another session of the Student Mentorship brought to you by the NMI. We try to do them always the first Friday of the month at 5 p.m. PST. So spread the word to your friends, to anyone. It's free to any student. They can access it, they can learn. The recordings, of course, are only available to NMI members, but $25 to $50 for a student member is actually one of the cheapest memberships.
It's a no-brainer. Yeah, it's a no-brainer.
And you already have 3 years of vital conversations recorded. I think like 3 years already, a little bit more. And plus the Vital and the Business, plus access to a Vitalist Facebook group where you see doctors like Dr. Seth, Dr. Sensening, Dr. Leticia Cronenberg, Dr. Fleetwood, Dr. Eli Camp, that have between 40, 30, 20, 10 years of experience talking to you about how they see cases. And if you have a case, you can put it in there, and people will put their information there. So again, try to connect with students and spread the word, because we know that this is sorely needed. We know that students need guidance, and we're here to serve. Anyway, have a fantastic evening. Hope you enjoy your day, and we will see you next month. So please come. Okay? Have a good night, everyone. Take care.